Hello and welcome to the Reflection Show with me, Martha and Spice. We want to have a conversation and I want to encourage every young man out there. In fact, if you're a man, if you're a male, if you're a male figure or a male gender, you need to listen to this conversation. We want to look at prostate cancer. Every man out there is at risk of prostate cancer. We want to make sure that our husbands, our fathers, our boyfriends, and our brothers are all safe and not at risk of prostate cancer. Make sure that you are glued to this episode because there is so much for you to learn. And if you're a woman, you can learn a thing or two to share with your male friend or even your husband or your boyfriend or even a brother. We'll be back. Stay tuned. Welcome back to the Reflection Show with me, Martha and Spice. Like I said earlier on, we'll be looking at prostate cancer. And I have here in my studio, Mr. Simon Ayamba. He's a principal nurse practitioner at the King's Medical Center in Butanga. Let me just say here in Tamale, but community around Tamale. Thank you very much for joining me on the show.
Thank you for having me.
So straight to the point, we want to look at prostate cancer. This has been a lot of concern to, let me say, men. But let's start when they say prostate, because most people have heard of cancers and we understand what cancer is. But what is a prostate and what makes this prostate cancer different?
All right, thank you. When you say a prostate, it refers to a tissue for only in the men.
Okay.
It is part of the sexual reproduction system of men only. So a prostate is found in only in a man. It is a gland. Those who did biology, you understand what a gland means. A gland is a tube that produces fluid in the human body. So the prostate is a gland that is located where the male reproductive sex organs are, which is the fluid in which sperm swim in during sex, or when semen, or what we call a semen.
Okay.
That is the combination of the sperms and the fluid. So the fluid that carries the sperm is what the prostate produces.
Okay. So
Yes.
joining the two, prostate cancer.
Yes. So when you say something is cancerous, or when you say cancer, a cancer is an abnormal tissue or an abnormal malformation of a particular tissue in its normal state. So for instance, a function of a particular thing. The gland is supposed to produce fluids. But along the way, you find out that the same tissues within the gland begin to change in structure, change in texture, and change in function. So when that one occurs, you say this tissue has cancer. Or you see additional tissues coming to form in which alters the function of that particular tissue. So you say something is cancerous when other tissues, other functions aside what it's supposed to do has occurred. So prostate cancer is the cancer of what I've explained in the prostate.
Okay.
Yes, that's why you call it a prostate cancer.
Okay. So how do I know? Okay. How does a man know that he has a prostate cancer?
Okay, so prostate cancer, it has a number of stages where one go through when you acquire it. Like I explained earlier, you have the benign stage and the metastatic stage. And the benign stage talks about when the prostate cancer is only just within the prostate gland. So with that one, it might be asymptomatic or the person might not know anything about it.
Okay.
But as the disease progresses, it will get to a stage whereby the challenges will start coming. Then you now having signs and symptoms. And one of them is erectile dysfunction. And erectile dysfunction is when a man is not able to sustain his erection during intercourse, or not even able to even have an erection at all. That is one of the signs. Then one of the common signs is men being unable to produce urine.
Okay.
When they go to the washroom. So you see a man standing in front of the washroom. He's finding it difficult for the urine to come out. He tries to push, it doesn't come. And even after he attempts and a little comes, he feels that there's still some urine
that wants to come.
When actually there's no urine. Then you begin to have samples of blood in your urine. Because when you strain, you realize that the tissues are damaged. So they'll produce some blood. So when you start seeing blood in your urine, It might not mean you have prostate cancer, but it is a sign.
Sign, okay.
Yeah, maybe I'm sure we'll talk about how you test. Yes, but it is also one of the signs in which a man should know that he has prostate cancer.
Okay. Yes. But so in that case, I don't think it can be transmitted from one man to the other.
No, for cancer you can't transmit it from one person to another. When you have cancer, it's for you alone.
So who is at risk?
Almost.
I mean, like, so it's in a man, but at what age?
Okay, so prostate cancer, like every tissue in the body, that has its function. After the age of 50, of late, we see that the numbers are coming down, but prostate cancer, ideally, after the age 50. Men are more at risk after age 50 than the younger people.
Okay.
Yes, so young people who have prostate cancer, it could be any other cause, but the risk factors start after 50 years. So a man of 50 years is more at risk than a younger person, like of my age.
So now, does drinking and smoking or certain lifestyles puts a man at risk of prostate cancer?
Yes, I was going to add to the other risk factors, and also there's a research that shows that black men, and I say black men, not the complexion, but African descent, they are more prone to having prostate cancer than any other race at all. We don't know why it is so, but it is also a risk factor. So black men are more prone to getting prostate cancer than the whites, and also those who are obese. Obesity, like the question you asked about lifestyle, I will talk about that one. So obesity is also a risk factor. Those who have very big body size. And when you talk about obesity, it has to do with the calculation. But when you're obese or overweight, you're also predisposed to getting prostate cancer. Yes.
So now you've mentioned some of the signs, which means that it could be and it could not be. So when you have some of the signs, it could be even another condition, not prostate. So how is it diagnosed? So if you have some of these signs, how do you get diagnosed of prostate cancer?
Prostate cancer can be diagnosed in the hospital.
Mainly, not you can't diagnose it yourself.
No, you can't. Like I said, some of the signs mimic other conditions. So to be sure that you have prostate cancer, you have to be diagnosed by a certified medical practitioner, because you have to be examined. Some blood samples have to be taken from you to the laboratory for them to examine certain things in your, I don't want to get too technical, but to examine certain enzymes in your body that will relate to the prostate cancer. Yes, so to be able to diagnose someone that this person has prostate cancer, you have to go to the hospital where the medical practitioner will now examine you, then request some tests for you.
So with the diagnosis, or let me say with the signs, are there some physical features or something in your body? Maybe is some part of your body going to become big or change in color or in certain way for you to know that, okay, this can be it. So I think we missed that.
Yes, for the prostate cancer, there's one striking thing about it that we normally miss. The person starts to grow slim, which we can't explain. Yes, prostate cancer, you see that the person just grows slim altogether. So you see a very big person. Then all of a sudden, the person's size reduces drastically without any explanation. The person eats well. The person does everything well. But all of a sudden, if it is prostate cancer, when you come and we take the history, we might look at your weight. We might ask you in the last 1 or 2 years if you remember your weight size. But with prostate cancer, it makes you reduce weight drastically, which is unexplained. We can't explain why it is so. But prostate cancer seems to have that clinical feature a lot. Yes.
So you said it can only be diagnosed in the hospital.
Yes.
So when I go to when I'm going to the hospital, what should I have in mind? Are they going to take my blood sample, or what are they going to check? Just take us through the checking process of prostate cancer.
Okay. So first of all, when you come, like I explained earlier, the prostate is located in the sexual organs of the man. So the initial examination is that the doctor have to examine you using the fingers. You put it through your anus.
Okay.
and check. That's where we check for the prostrate.
Okay.
So we know the size of it. It is kind of like the size of a walnut fruit. I don't know if you know a walnut fruit.
No.
Yes, it's not so big, but by practice, I
You've
can
been
tell
able
the
to,
size.
yeah.
Yeah, I can tell the size. So when you put your finger inside there, you can tell whether it's enlarged or whether it has shrunk or whether there are other tissues surrounding the prostrate gland. Because it's a gland, it's supposed to be smooth. So when you put your finger there, you can know the texture, you can know the size of the prostrate. So if it is enlarged, it is a precursor for you writing other laboratory tests.
Okay.
So like you asked earlier, there will be a blood sample taken.
Okay.
They'll take your blood sample. They'll also take your urine sample.
Okay.
Then there are other tests that you can also do. That's what we call it's a machine that they use to check. It's a scan. Yeah, it's an ultrasound where they can scan your pelvic girdle of the man to also look at the surrounding features around the prostrate to know whether they are also infected or how far the infection has affected you.
Come.
Yes.
Wow. So after all that treatment, how does one, is it curable? Can you just treat it once and for all and to go, or it's only managed till maybe you are dead or something? How is it?
Well, there are options. One option is, like I mentioned, it depends on the stage of the disease. So if the stage of the disease is still in the prostrate, there's an option where we can pass you a catheter. That is if the urine is your problem. So at the initial stage, if the urinating is your problem, we'll pass you a catheter. A catheter is that long white tube we'll put through the reproductive system,
Okay.
through into the bladder,
Okay.
so that we'll cap it for you. So when you have the edge of passing urine, you don't have to strain again. All you need to do is to open for the urine to come out. Then you are
Wow.
free. Then you come to the hospital maybe every other month for us to change the catheter, because it's a tube within the
Yeah.
male reproductive system, and
Okay.
it can attract infection. The other one too is that we can remove the prostrate through surgery if you are sure that you are done with giving birth.
So removing it means that you may not be able to produce semen again or sperms again, so you can
You can have children, but not through the normal means or the natural means, because the prostrate, like I mentioned earlier, is the gland that produces the fluid that carries the sperms into the woman during sex.
Okay.
So when you remove the prostrate, that aspect of the fluid, because the sperms need to swim through a medium during sex, but the sperms are actually produced in the testicles of the man, which is dry, or let me say non-fluid. So it's during sex that they meet, and where they meet is the flow of the fluid is the prostrate. So a man says, "I've ejaculated." So the fluid that you see is actually the prostrate fluid.
Okay.
But the sperms are embedded, which cannot be seen physically, of course. So when we remove your prostrate, that fluid cannot be produced. But you can get children through any artificial means,
Okay.
where the sperms can be extracted
Yeah.
onto another medium, then transmitted into your wife.
So now, are men who are not having sex, or let me say men who are virgins, are at risk of prostate cancer?
Like I mentioned earlier, the prostrate is a very interesting gland.
Okay.
Yes. When we were studying in school, there was this theory called Darwin's theory of evolution, where it talks about use and disuse of body parts.
Okay.
So God has made it in such a way that if you are not using a body part, it becomes redundant. If you are overusing a body part,
MD, calm down. If you're not using, sorry, if you're not using a body part, it becomes redundant.
it becomes redundant.
But you use it to urinate stuff, so you're using it.
Well, the male sex organ has two functions, basically two functions. When it is not erect, it is a urinary organ.
Okay.
When it is erected, it's a sexual organ. So you are using it for only one side. So men who are not using it, actually, there's no problem.
Okay.
But like I mentioned earlier, when you increase in age, Because that fluid is supposed to move. It's like leaving water in a stagnant place over a long period of time. So if you are not clearing your water out of your poly tank for a long period of time, you realize that there are debris gathered in between. So after the age of 50, if a man has not had sexual intercourse
Of 50.
From age 0 up to 50,
50.
yes.
Okay.
So after that age, if a man has not had sex at all, he's at a higher risk. I won't say he will get it, but he's at a higher risk of getting prostate cancer than someone who
So
has
sex reduces the risk of getting prostate cancer.
I'll say yes. For the married men,
I'll
say
come
yes.
back for the married men. I'll come back for more details on that. Let's go for a break.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Mark is King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of Kingdom Dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle and many more.
Welcome back from the break. To the married men, of course, but if you are not married, it's advisable that you don't have sex. MD, on your last point, you mentioned that it can help sexually active men. It can reduce the risk at which they are prostate cancer.
Yes.
So with the single ones, what do they do?
Well, we preach abstinence.
Okay.
So, like I said, no one is single.
So which means that you have to get married early, right?
Yeah, it's very advisable.
Okay.
It's very advisable to get married early. So, with a single, like I said, after the age of 50, the risk increases. But like I said, the black man, they say we are at risk of getting it more than any other risk. So whether you marry or you don't marry, we still have that risk of getting it. So our race alone can predispose us to it. But there are other options you can take to reduce your risk of getting prostate cancer, and not just through the sex alone.
So what are the other options?
Yes, one good thing about avoiding prostate cancer is regular exercising. Men, or like you said, the youth. That's why we advise the youth to exercise regularly. So when you run some meters within a day, it reduces your risks. And also avoiding alcohol.
Okay.
Alcohol is something that can also predispose someone to getting almost all diseases in this world. And also smoking.
Okay.
Smoking tobacco, taking hard drugs. Those who are into cannabis and other things, it also predisposes them, or it increases your risk of getting it. And also there's this theory about eating fruits.
Okay.
When you eat fruits, it actually boosts your immune system and also reduces your risk of getting prostate cancer or any other disease. And avoiding fatty foods. That's one side that, because we talked about obesity earlier. When you take a lot of fatty food, it increases your risk of getting almost most of the heart diseases and a lot of cancers. So reducing fat in your food alone can limit your risk of getting prostate cancer.
So I want us to go back to the treatment. I think one key thing you mentioned was the surgery. And I also want to, so is it that it can be managed just like other, let me say, disease where you are on medications for, let's say, the rest of your lives? what are some of the treatment options that prostate cancer has?
Yes, the limit or the type of treatment it has would depend on the stage of the cancer. So like I mentioned earlier, cancer has some stages. So if you are in the first stage, we'll say we'll treat you based on your symptoms or treating you symptomatically. So there are some medications, I don't like to mention them on air, but there are some medications we can give you to boost your chances of not progressing to the next stage. Okay. And there are other measures where...
So there are stages?
Yes, there are stages of the cancer.
Okay.
And at each stage, there's an option for a treatment. So at the stage 1, you could say that it's within the prostate alone. It has not moved into the bloodstream. So you could manage it in such a way that what is the symptom it is producing at that time. So let's say you have difficulty in passing urine. Then we'll pass you a catheter. Then we'll put you on medication to limit the spread of the disease. Then it moves to the stage 2, whereby you have, so even in the stage 1, if you have erectile dysfunction, there are some medications we can give you to boost your sexual activity or your sexual performance.
Does it reduce sexual drive when you have prostate cancer?
Fortunately or unfortunately for men, our sex drive does not decrease.
Unfortunately. So no matter what you have,
yes, a sex drive in a man is always constant.
Constant variable.
Yes, it's a constant variable. That's our blessing from God. But for the performance, how to now perform it, that can reduce, or the ability to sustain it, that can reduce. Yes.
Wow. So now I want us to look at complications depending on the treatment and where you should go for appropriate treatment. What are some of the complications that would come? 1, if it's not diagnosed early. 2, and at what stage can there be more complications than what? So if it's like that stage 2 at a high risk of having more complications than stage 1. And
Yes.
yeah. So.
Yes. That's right. At the stage 1, the complications are minimal. That is, if it is not treated. So, for instance, if it is only in the prostate, it's minimal. But like I said, it can move into your blood. When the cancer moves into your blood, it can even get into your bone. And when it gets into your bone or your bone marrow, it can give you some severe pains. So you feel some men are always walking and they have waist pain. So you might realize that, like you said, if it's not diagnosed early, so you keep having those early symptoms we spoke about, then all of a sudden you are complaining of severe waist pain. It means that it might have moved into your bloodstream, moved into your blood or into your bone. And also it can move into your lymphs or your lymphatic systems. And when it gets into the lymphs, that is where the bacteria can infect your defense mechanism in your body. Your lymph contains what? Fights infections in your body. When they are able to overcome them, then you are now prone to a lot of other infections. But the pain in the waist and the bone marrow is one severe complication that if it is not detected early and it moves into the bloodstream, then gets into the bone marrow, you have this excruciating pain, which no pain medication can even take the pain away. It will just reduce the pain within the next few minutes. The pain is back.
Wow. So it means that someone can probably have it till death. It can only be managed.
For managing, like I said, there are options at each stage. So the prostate can actually be removed without any complication in the man, depending on the severity of its effect on your body. So like I mentioned earlier, if we look at the risks and the benefits of removing the prostate against leaving it in your body, we discuss the option with you. So maybe you are a man who wants to have a child and you have prostate cancer. Your doctor or your surgeon can discuss with you the option of leaving the prostate in you and removing it, and you getting your babies through any other means aside the normal means. So when you remove the prostate, when the cancer is only in the prostate, you can eliminate the disease or the cancer out of your body completely.
Okay.
So removing the prostrate altogether, or part of it, depending on where it is affected. So you can actually remove part or all. But when you remove all the prostrate, the cancer is gone. So you can say that the person is free of the cancer.
Yeah.
But there are higher chances of you getting cancers.
Yeah. So
in your
can you
lifestyle.
also say, okay, give me like a 6 months or 1 year, let me go and impregnate my wife, then later on I can come back and do the surgery to take out the prostate completely. And if that time can be given, is a person at risk of getting a spread or having complications of that? Or as soon as it's diagnosed, you need to have the surgery to take it out?
No. Immediately you are being diagnosed, you'll be told the stage in which you are. And the stage will depend on the signs and symptoms that brought you.
Okay.
So if you are in stage 1, maybe I should have categorized them. If you are
Okay.
in stage
Yeah.
1,
So how many stages are there in total?
there are 4.
Okay. So take us through the
There are
stages.
4 stages. So at the stage 1, like I said, you are not aware that you have the symptoms or you have the cancer. So you are just walking, you are asymptomatic. Then getting to the stage 2, you start having some symptoms such as having difficulty in passing urine. Then you have some scanty blood. It looks bright red. Then you move to the stage 4 where you realize that the blood is increasing. Then you realize that you are not able to sustain erection. After you finished maybe 1 round, the second one, completely, you can't. Yeah, it will not rise again. That is one of the very common symptoms in stage 3. The man is unable to have erection at all. It's completely off. And when you get to the stage 4, where it moves into the other parts of the body, so it gets into the bloodstream, it gets into your bones, it gets into your lymph, then it moves even your bladder.
Okay.
It can get, because the prostate is not far from where the bladder is. So, and that's why the blood comes in the urine. And the urine is contained in the bladder.
Okay.
So you realize that you start having urge to pass urine. Then you urinate more in the night, but you still can't pass the urine. So at each stage, we monitor you, then to know the possibility and the level of damage it has done to your prostate. Then we advise you on the option to take. Yes.
Now, I want us to look at, so can I just walk into a hospital and check, let me just to screen?
Yes, you can actually walk to any facility. Then you ask that, you would like to have, in fact, it's advisable that men check their prostate twice a year.
Okay.
Yeah.
No matter what age you are.
Yes, it's advisable that you check your prostate. They say check your prostate as you check your teeth.
Okay.
So when you visit the dentist that month, go and also have your prostate checked. And it's a very simple procedure.
Yeah.
It's non-invasive. Yes, it's non-invasive. You don't have to be given a needle or those who fear injection. There's no injection about it. It's just an examination.
Hey, then I tell these women that fear injection.
Oh,
yeah?
some men fear injection.
Can prostate cancer be prevented?
A lot. You can prevent prostate cancer by avoiding a lot of tests. Yes. And one of them we mentioned earlier was regular exercising and eating healthy diet. Diet is one thing that can help you prevent cancers in your body.
Okay.
Yeah, eating a lot of carcinogenic food, we call them carcinogenic food, or foods that are predisposing you to cancers. Eating a lot of fatty foods.
Okay.
And drugs, hard drugs, people who are into drugs, and smoking, tobacco and heroin,
Weed and all of that.
and overdosing of drugs,
Okay.
because the drugs tend to move into almost all bloodstreams, and it moves to other aspects of your body, which can also affect the function of other things. So like we mentioned earlier, cancer is any abnormal tissue in your body. So when you take drugs and you take alcohol, it changes the nature of the tissues in your body. So they detect things differently, then absorb them, then begin to function abnormally. So when you take all those things, it tends to change the nature and function of your tissues in your body, including the prostrate gland.
But I was talking about some physical signs early on. Does it affect the sexual organ or the testes or anything to change its growth or in a particular way?
No. One striking feature that I have personally observed is a man who was taking an aphrodisiac.
Okay.
Yes, you know, people take aphrodisiac to enhance sexual performance.
Okay.
When you take it regularly, what happens is that the prostate can enlarge in size.
Okay.
It can enlarge in size.
Because of the aphrodisiac you are taking.
No, not just because of it can enlarge either through drugs. That one can be a cause or through an infection. So that is not a cancer, but it can predispose you to getting a cancer.
Okay.
So it's also one of the risk factors. But I met a man who was taking an aphrodisiac to enhance his sexual performance. Then, you know, those side effects of the aphrodisiacs, they don't spell them out to you when you go to buy. And you too, subconsciously, you think you are going to use it to achieve a purpose of satisfaction or gratitude. But after he took it for a while, you realize that without the aphrodisiac, he could not even sustain an erection.
Wow.
Yes. So that's what we call intoxication in the body or getting addicted to a drug. He needed more of the aphrodisiac to be able to perform what he used to do. So he added more. So when he came, I examined him and realized that his prostate has enlarged. Yes. At that stage, he was not.
But he didn't have cancer.
He didn't have cancer at that stage. It had gotten so big that he could not even pass urine. Because when it grows big, what happens is that there's a pathway by the prostate near the bladder. It's called the urethra, where urine is supposed to flow through. And because it's tube-like, when it grows big, it occludes or it kind of strictens the urethra, making the opening tiny or reducing it in size for the urine to be able to come. So the urine is produced all right, but the pathway in which it's supposed to come, it's like a balloon. Yeah, I can use the example of a balloon. It presses against it. So he could not pass urine. So after he had an episode of sex, and that night, you know, after sex, it's encouraged you pass urine. He could not pass the urine.
Why?
Yeah, that would be for another discussion.
Just add up that.
No,
That might just be the only thing somebody will learn in this episode.
Okay, well, after sex is encouraged you pass urine because the same pathway where the prostate
semen
gland
or
and the
this-
semen
okay.
passes for men
Okay.
is the same way pathway urine passes.
Okay.
But like I explained off air, the male sex organ is both a urinary and a sex organ. But it depends on the state of it.
Okay.
When it is erected, it is a sexual organ. When it is not, it is a urinary organ. But there's a closure, or let me say a sphincter, that closes the gap between the sexuality and the urinary function of it. So after you finish having a sexual intercourse, it is good you flush out whatever residue of semen might have stayed within you. So that can help to clear any other debris. Then a flow back might cause other things because the prostate is a very sterile place. So even though when it moves out and it comes back, it's not supposed to come back. When it does that, it can cause infection and can predispose you to getting cancer.
Okay.
So his first symptom was inability to pass urine.
Okay.
When we checked, we realized that he had a large prostate. Yes, for that we were able to manage him. But I asked him further and realized that his father ever had prostate cancer.
Wow.
Yes, that could also be a risk factor.
That's your
if,
father or your
if in your family
yeah.
anybody has ever had prostate cancer, then we put him on medication. But after 6 months, he came back and he had the cancer.
Why? So does it mean it wasn't diagnosed early? The prostate wasn't diagnosed early?
No, at that science, we have parameters we use to measure whether there's a presence of what do you call it? we call it the PSA, whether there's a presence of prostate cancer in your blood. So when you test that person, there's either 1, 2, 3, or 4. So he had 0. So at that stage, he was still absent. But like I said, it progresses. So something can trigger you for you to have prostate cancer in the future. But it can begin with just something small, inability to pass urine. Yes.
Wow, prostate cancer is I don't want to say scary. So that's like stage. His own was up to the last stage.
Well, I had to refer him to a specialist. It's actually dealt by specialists who are higher in facilities.
Okay.
But at the time I saw him, he was still in stage 1. Yes, I had to refer him for him to go and see a specialist, a urologist. They deal specially with those people.
Issues.
Yeah, it's a very special place, so it needs special.
It's a very special place, so it needs special attention. Let's take a break.
Books by Pastor A.L. Fant. They are inspired by the Holy Spirit, simple to comprehend, relevant in application, and so lovely to read. Grab copies like Dynamics of Kingdom Influence, Dynamics of Ministry, Mark is King for Church Workers, Money Matters, and she calls herself a woman. This marriage must work. No more curses. Loaded mouth. Secrets of kingdom dominion. The exploits of service. Things fall apart. Church without bleeding pulpit. Singles mingle, and many more.
Welcome back. I believe that everyone watching this episode today is getting more knowledge on prostate cancer. And of course, you don't have to say, oh, I'm a girl, I'm a woman. No, you one day get married. So these are very important questions you should ask your spouse, not just what's your blood group, what's your genotype, are you HIV positive or negative, but you need to let your boyfriend or your future husbands make sure that they don't have prostate cancer, or even they're on treatment or whatever it might be. Now, I want us to, we have just like 10 minutes more to wrap up. Now, is it a bit different from hernia?
Oh yes, hernia is very different.
Okay.
When you say a hernia is a protrusion of a body organ to another space of another body organ, which is not supposed to be located.
Okay. So
yes, that's a hernia.
But the prostate, the man already has a prostate.
Yes,
the one is enlarged, or
yes,
it becomes okay.
Yes.
Okay, I get it now. Now with sex with men, we've established that that can also be like a risk factor for them. I wanted to ask a question a bit about the aphrodisia that you took. So it means that even somebody below the age of 50 that is addicted to aphrodisias can be at a high risk of getting prostate cancer.
I can't say yes or no.
Okay.
But like I mentioned earlier, a continuous or an abnormal function of a body part by an inducement or induction of other things can alter its function. And like I said, it's a predisposing factor. So aphrodisiacs tend to alter the normal function of the tissues within the male sexual organ. But there are certain components of a drug, we call them expedients or excipients. Excipients is, for instance, if you are taking a particular drug for malaria, there's an active ingredient of the drug in it.
Okay.
And there are other things they use to add to the drug to hold the drug. So when you take the drug, And those are the things that will cause you the side effects. So you realize that you have malaria, you take the drug, but you are itching.
Okay.
You have this metallic taste in your mouth. You have abdominal pains. That's not the function of the drug.
Okay.
It is what we call the excipients. They cause those things. So these aphrodisiacs, they contain certain cancerous agents that can predispose someone to getting the prostate cancer. So when you take the aphrodisiacs, they may perform the function which they came to do. But those other ingredients or agents within the drug, that is not intended to cause the function in which they came in.
Okay.
Stay in your body.
Okay.
Yes. And they also predispose someone to getting the prostate cancer. But you can't point to the fact that this is what caused it.
Okay.
Yes. But it can be a predisposing factor.
So in everything that we've learned today, give us your tidbit. What are the most important things that people should know about prostate cancer? And like I said earlier on, women shouldn't think that it doesn't concern them, so it's just about the men. What should we do? And what role can, let me say, wives, wives play in helping their... It's a good question, right? Let me say girlfriends. Wives and girlfriends play.
Let me start with the wives. For any wife who is listening to us, regular sex is very important for your husband. Regular, continuous sex.
Hey, MD, regular, continuous sex is good for your husband.
For the married people.
Okay.
Yes, because like I said earlier, the prostate, it produces fluid. So regular sex of it, or regular use of it, helps to clear whatever debris is there, and it keeps it active. But of course, overuse of it too can also mean, but you can't overuse sex in marriage. It's good for couples to always have sex. Every day is if you can. So the women, they always say you are tired. Don't give excuses.
Now you're doing marriage counseling.
Yes. So you realize that but studies actually prove that men who have regular sex, they have a lower risk of getting prostate cancer.
Married men, please. So don't go and tell your girlfriends that if you want to help me to reduce my risk of getting prostate cancer, then let me have regular sex. But this is for the married men.
So like you said, living a healthy lifestyle can reduce your risk. And every man should try and check their prostate at least once a year or twice a year. And like I said, checking your teeth is as good as checking your prostate.
Okay.
So when you visit your dentist to have your teeth checked, go to the doctor. It doesn't take more than 10 minutes to check your prostate.
Okay.
At even 5 minutes, they will just check it to see, how small it is. Has it enlarged? Has it reduced this? But some of the signs we mentioned, they might not be related to prostate cancer.
Yeah. That's why you have to check to know the exact one.
Yes. So at least as every man, as part of your regular medical screening, you should check your prostate and avoiding alcohol, and regular exercises is one key thing that you can use to reduce your risk of getting almost all diseases in this world. When you keep exercising regularly, your hormonal imbalances are very intact, and you get more happier when you exercise. So it reduces a lot of stress hormones in your body, which can lead to cancers. Yes.
Your very final words on this topic. Your very final words.
My final words to our audience is that prostate cancer is better you detect it earlier.
Okay.
The early detection helps in minimizing your risks. But if you are already in it, there are options you can take depending on the level and the degree to which the disease has taken you to. You should talk to your doctor or whoever is taking care of you. Then you discuss the options. I don't want to say a crude way of people getting it, but you should have a discussion as to the option of what you should take. But of course, if you are okay with them taking out your prostate, you will still remain a man. You can still have your normal activities. Just that you might not have children naturally if you want to. So checking prostate is good, and medical regular screening. You should add prostate screening to to your screening daily. And we should all live a very healthy lifestyle.
Yeah, we should all live a very healthy lifestyle. I have been speaking with Mr. Simon Ayamba. He's a principal nurse practitioner at the King's Medical Center in Butanga, helping us to understand prostate cancer and how you and I, yes, everyone has to make sure that we reduce the number of cases of prostate cancer that we have. And then it's not just for the men, but the woman. Probably you can tell a man near you that it's important he goes to have his prostate checked, because some of these things can cause death, right? Some people have died of prostate cancer.
Yes.
So you don't want your husband or your boyfriend or your father dying because of prostate cancer. I'll be back with thoughts. Hello and welcome to Thoughts from Martha and Spice. We just had a conversation about prostate cancer, and today my thoughts is just going to be very short. I want you to think about your health, your life, and some of the risk factors that we mentioned. One thing very personal to me after this conversation is aphrodisiacs. A lot of us are taking aphrodisiacs. We might not see the issue or the complication now because we are young, we're in our 20s or in our early 30s. But before you hit 50, if you are not careful, you might be at risk. Let's all make sure that we go to the hospital today or very soon after watching this episode to get our prostate checked if you're a man. If you're a woman who has a male figure in your life, please do well to encourage them to go to the hospital to get their prostate checked. Thank you for watching this episode. Do have a good night.